Good afternoon, everyone, and thank you for attending this month's RDHRE Preparedness Series webinar. For today, we're going to discuss the challenges of behavioral health for first responders and healthcare providers. We have two guest speakers joining us today, Dr. Jerry Walker and Jason Workman. Just a little bit of information about them. Dr. Jerry Walker is a board-certified counseling psychologist who currently works as a psychology services manager for Nebraska Medicine, overseeing the psychology department, the chronic pain management program, integrated primary care behavioral health operations, and regional disaster behavioral health planning. He received his undergraduate training from the University of Texas and his PhD in counseling, psychology, and human systems from Florida State University. He then served 8 years as a psychologist in the United States Air Force, holding multiple leadership positions in both clinical and operational psychology. His final position with the Air Force involved human factors risk assessment and performance enhancement of military intelligence personnel supporting special operations missions around the world. Dr. Walker moved to Nebraska in 2019 to be closer to family. In addition to his role at Nebraska Medicine, Dr. Walker is an active in various communities and as a board member with the Nebraska Psychological Association. He's completed a postdoctoral master's degree in clinical psychopharmacology and has served as a sports psychologist for Union Omaha for the past 2 seasons. His areas of expertise include trauma and resilience, disaster behavioral health, organizational psychology, and LGBTQ issues. Our second speaker today is going to be Jason Workman. Jason has received a master's degree in clinical mental health counseling. Jason's a licensed independent mental health practitioner, licensed alcohol and drug counselor, and clinically certified trauma professional. He's worked with first responders in Nebraska for the last 11 years as a law enforcement chaplain, as a member of the state critical incident stress team, and is presently a regional clinical director for the state CISM team. His experiences include previously serving as a firefighter EMT in Northern California, CPS investigations, Nebraska Department of Correctional Services, and Nebraska State Probation. Jason's experience and passion for working with first responders is what has led him to create the First Responder Support Team. Today's webinar description, target audience, and objectives are on the screen. Today's webinar is accredited for continuing education for 1 hour for physicians, nurses, and EMS providers. Disclosure declaration. Our faculty today has nothing to disclose. For our planning committee, Dr. Lawler does have disclosure, and the other planning committee members have nothing to disclose. For today's webinar, there will be a live Q&A at the end of the session. In the meantime, if you could please put any questions into the Q&A box found on your Zoom screen, and we'll send those to our speakers. And then following the completion of the webinar, you will see an email from our continuing education department at the University of Nebraska Medical Center, and you can go here to receive your CEU certificate. With that, I'll go ahead and turn it over to Dr. Walker.
Thanks, Lauren. Good afternoon, everybody. Welcome and thank you so much for joining us. I have the pleasure to address you all today and talk through some fatigue and burnout issues specific to our communities and really focus on what we can do to foster better peer support with and among each other. Lauren, next slide, please. So a lot of this is drawn, the information you'll see from different peer-reviewed sources. I've listed them here. And as Lauren noted, I have some experience with disaster behavioral health planning and response with the military. Specifically, I've worked with first responders in a variety of different areas, so firefighters, military police, explosive ordnance disposal, and then some folks in military intelligence special operations fields. And I've drawn from some of the work I've done with them to help inform the presentation I'm getting ready to give you, because these are people who on a regular basis anticipate being exposed to or being directly embedded in potentially traumatic situations. And so the way that we steel our mind and prepare ourselves for these kinds of situations and the ways that we deal with it after the fact can have a huge impact on our long-term ability to cope as well as our resilience. Next slide. So I'm going to talk to you today about fatigue and burnout and review some common factors that may play a role in our experience of emotional exhaustion, occupational fatigue, burnout, all those kinds of things. We'll do a brief review of the impact of stress and trauma to our physical and cognitive functioning. I'll review some effective or helpful ways to cope and contrast those with less helpful coping methods. And then the bulk of the presentation will be discussing ways that we can systematically increase our resilience response to these kinds of stressful or potentially traumatic situations. So none of what I'm going to show you is probably surprising, but if nothing else, should be a good reminder of the things that we should be doing really on a regular basis, but especially in the wake of high stress or potentially traumatic situations. And if you already feel like you're doing really well in these areas, then keep these in your toolbox for when you find yourself inevitably reaching out to your peers or your colleagues who may be struggling themselves. And then I'll finish by talking about how peer support networks can play a crucial role in providing community resilience. Next slide. All right, so let's start with some definitions. So on the work side, we've got a continuum that ranges from just basic occupational stress all the way down to burnout. And this is something that I think many of us have experienced, not just over the course of the pandemic, but especially exacerbated by the pandemic. We've had increased stressors associated with PPE, with challenging or vague, unclear situations, role changes where we've had to take on more or are unsure of who maintains the responsibility for certain actions. And all these things can contribute to the normal stress of our jobs on a daily and cumulatively longer term basis. So stress in and of itself is not necessarily bad, maybe challenging, but to the point that we feel like it's still within our coping capabilities. Once we get fatigued, that's the point where stress is starting to overwhelm us. So we start to have thoughts like, I don't know how much longer I can do this. This better be short term because this is a real challenge. But if it continues for a longer period of time, or if it even gets worse and we see no light at the end of the tunnel, many of us can get to the state of burnout. And this is what we see happening across the national landscape right now with many healthcare professionals, especially nurses, leaving not just their current jobs, but the profession altogether. They're getting completely burnt out of the work that they're doing because of the severe and prolonged nature of their stressors. Advance one more, Lauren. Now contrast this with emotional fatigue. So this construct really has to do with not just work or occupational roles, but everything else going on around our lives. I've never loved the concept of the work-life balance because it sort of implies that work is separate from the rest of our life, when really the two interact and work is a part of life. Many times we find that we bring our work with us into our home lives, or the lives we have outside of work, and vice versa. And so you may experience the sense of emotional fatigue separate from your occupational stressors or overlapping with your occupational stressors. So much like the continuum described above, emotional fatigue is when we're starting to feel exhausted and we're feeling worn down. Emotional exhaustion, when we start to not have access to positive emotions. We have difficulty controlling them, find that we're getting more irritable to the point of distress, feeling like we're falling apart, and this is the point where we can really start to make some poor choices that may help in the short term, but can make things worse in the long term. Next slide. So in part of my work with the military, I looked at in certain high stress, high risk career fields, what kind of things contributed to a lot of negative coping strategies. These were situations where we had a high number of folks abusing alcohol, getting DUIs, getting other alcohol-related incidents, using extreme quantities of caffeine. We're talking like 5 or 6 energy drinks per day on a regular basis. Having marital and relationship issues. There's an extremely high divorce rate, but only a small percentage of these folks would actually seek help from somebody like me, a psychologist, or from their unit chaplain. And so through a number of surveys and different statistical methods, I was able to parse out the commonalities in these units, what seemed to be going on. And a lot of the linchpin for these outcomes had to do with this orange box. So this is chronic and elevated ANS physiological arousal, which you may recognize as the primary CNS component involved in our fight or flight response. Next slide. And this comes from stress. Now, not all stress is bad. Next slide. We've got two different kinds of stress. One, eustress, which you probably haven't heard about very much, is actually the good kind of stress, the one that helps us focus and actually improves our ability to attend to certain tasks, especially life or death type tasks, helps us maintain our composure and actually allows us to be more productive. The other end of the spectrum would be boredom and just a lack of motivation. But if this stress keeps up for a longer period of time or gets even more severe, it can become distress, an inability to turn off that stress response, where we start to actually experience physical and cognitive damage and have difficulty actually pulling back from that, feeling restless, agitated, jittery, unable to calm down pretty much all the time. And this is the point where our sleep can be affected as well. Next. So if you're experiencing this distress, it can be momentary. It could last for a day or two, but if it lasts for a longer period of time, that's where we start to get that emotional fatigue. Emotional fatigue over time can lead to exhaustion, and that's ultimately what causes burnout. Next slide. I want to differentiate this from trauma because while stress and trauma are sometimes used interchangeably, trauma is more event focused. And we can experience this at a point in our careers. In fact, many of you on this call probably experience a potentially traumatic event on a fairly regular basis. And it's not always just one event that creates a traumatic stress response. Sometimes it's the accumulation of traumatic stressors. For example, I've worked with one individual in my military work, for example, who witnessed individuals, dying or tortured on a regular basis and was completely fine up until about that 50th exposure. And for whatever reason, that was the one that overwhelmed his coping capacities. There have been other situations I've seen where something is more relevant to somebody. If you've got small children and you witness injury or death of a small child that reminds you of your own children, that could be more traumatic or more impactful. And so it's not necessarily that stress is bad. It's not necessarily that an event may affect you in a traumatic manner, but sometimes it's the accumulation of these things that really starts to affect us. Next slide. Now, I mentioned the HPA axis, and this is mediated by the autonomic nervous system, divided into two branches, so the parasympathetic and the sympathetic nervous system. I won't go into too much detail here, but what I like to point out is that the on switch for our sympathetic nervous system and the off switch are mediated by the same mechanism, but they don't have the same vertebral connections, meaning they're, in the afferent and efferent connections in our spinal column, they're not directly corollary. So you can have parallel activation of both of these responses, or you can try to engage your parasympathetic nervous system, but notice it only puts a dent in the sympathetic nervous system. So certain things, certain medications, certain relaxation exercises we can do can help, but they may not be, they're necessary, but not always sufficient into deactivating that fight or flight response. And what we're going to do today is talk about a number of ways that you can better attune your body to respond to some of the mechanisms we need to turn off that fight or flight response, especially in the wake of a prolonged stress or trauma response. Next slide. So I know this is a bit of an eye chart, but I'm going to tell you what you need to know. Like we showed earlier, some amount of stress is good, and it's actually helpful. If we're needing to, be on full alert, ready to react and respond, need to make quick decisions, it can be helpful to be more in this active alert phase. Now, most of the time, our body's kind of more in that calm or lethargic phase. We're not really needing to be on high alert. We can be kind of low key, relaxed, and that's what I like to think of as a steady state. Lauren, can you advance one for me? And this is really where our body and our mind function optimally. But there are situations that call for an increased level of alertness and increased engagement. So Lauren, if you shoot the next one over, this would be the range where, from an operational standpoint, where we would want to be so that we can quickly respond and we can, take advantage of that hyper arousal. And one more, Lauren. But if we find that we're kind of living in this, always fight or flight or freeze state, this is where we can start to have, the emotional fatigue and emotional exhaustion starting to set in. We find we have difficulty turning that off. Next slide. The good news is that there are things we can do to bring things back towards this middle level. If you guys have seen this before, this is called a Yerkes-Dodson curve. And it's the idea that, to get to eustress, sometimes we have to actually activate our fight or flight response just a little bit, just to get up to that point where we feel energized and we're able to focus. Or if we're in the far side on the stress level, to bring it back. So we're not trying to eliminate stress altogether, but get it to a more functional area for what the demands of our current activities require. Next slide. So throughout this pandemic, like I said, we've had increased challenges, and that puts us at higher risk for psychological distress. One of the things that we've noticed very early on is that a good number, about 30% of first responders, so people are on the front lines, are going to be at an increased risk because of all these different factors for developing a new mental health disorder that they haven't had previously. This could be your run-of-the-mill depression, anxiety, could be post-traumatic stress disorder. Most commonly from what I've seen is sleep issues, chronic and intractable insomnia, develop of a substance use issue. So, just out of a way to try to cope with things, either drinking more at night to try to de-stress, to bring that physiological arousal level down, or to get to sleep. Using certain drugs, even legal drugs like tobacco or caffeine, as a way to try to continue to cope despite this arousal. And this is, double the risk if you previously struggled with one of these conditions. You're at a much higher risk for experiencing a recurrence of, anxiety, depression, things of that nature. Next slide, Lauren. And these can manifest in a variety of different ways, kind of depending on you and who you are. So from a physical level, all manner of different physical complaints, muscle pain or tension. I hold a lot of stress up here in my shoulders. So if you notice that you're getting a lot of tension here, or clenching your fists or your jaw involuntarily, you start to develop some pain along your TMJ. Maybe you lose your appetite. Maybe you get extremely hungry and you become more prone to overeating, difficulty sleeping, that kind of thing. From an emotional standpoint, if you're kind of living in the bottom levels of a mood elevator, for example, that may be a good sign that you're getting to the point of emotional exhaustion and psychological distress. From a mental standpoint, this can manifest as difficulty concentrating, just not being able to remember things, feeling confused or disoriented all the time. We're always thinking in worst case scenarios. We call that catastrophizing. And all those feelings and sensations can contribute to a lot of behavioral actions that are, let's just say, not very helpful. So being really irritable with other people, getting in more verbal conflicts with coworkers or with your significant other, using drugs or alcohol more frequently, having difficulty engaging like your normal self-care behaviors, or maybe going overboard on some of those things, over-exercising. Is another example. So all these could be signs that you're getting on to the verge of being burnt out or experiencing significant psychological distress. Next slide. And so unfortunately, we can come to gravitate to methods that may feel like they're helpful in the short term, but in the long term are not going to be as helpful. So engaging in risky behavior, using drugs or alcohol excessively, trying to find an outlet for these negative emotions, especially anger, things like that. All these different things may help help us feel better or seem like they're a cathartic outlet in the short term, but they're not a good long-term strategy, and they could actually make things a lot worse for you in the short term as well. Next slide. So what do we do, right? I just painted a kind of a doom and gloom picture. Well, the key is to utilize our resilience and actually engage intentionally the facets of our functioning that can help build that resilience in the long term. Big part of this starts with stress management, figuring out how or knowing when we're stressed and being intentional about managing stress in a productive or more helpful manner. Modifying your thoughts, paying attention to the thoughts that are flowing around in your brain and looking for the ones that are not going to be as helpful or not going to be as realistic. Taking care of yourself on a physical level, and then getting support, either social support or mental health support when you feel like you need it. Next slide. So I've given you a list here of all kinds of different things that you can use for stress management. And the reason why these are helpful is because they engage a lot of different areas of our psychological well-being or our health and wellness. There's a model in the field of positive psychology. We're not very creative. We use acronyms called the PERMA model. So has to do with 5 different areas, PERMA, that contribute to our sense of well-being, satisfaction, life, sense of contentment, meaning and purpose, that kind of thing. And each of these different actions that I've listed here play a role in one or more of those areas. So the P in PERMA stands for positive emotions. Several of these things, like listening to music, working on a puzzle, engaging in a hobby, are helpful because they specifically make us feel good. They give us a sense of joy, gratitude, happiness. And even though it's temporary, that can counteract negative emotionality you may be feeling in the moment. Engagement is the E in the PERMA model. Again, things like reading, working on a puzzle, even exercise are important because they engage us and they enrapture our mind and our attention in that activity in the moment. We need this. We need to find an outlet that allows us to focus not just our attention, but our emotions in something for a prolonged period of time because it's extremely satisfying. It distracts from the things that are going on outside, outside of our lives and other areas of our lives and gives us a little mental vacation, so to speak. Our relationships, that sense of connection we get is extremely important when we're struggling. And, we can actually get involved with other people in a lot of these different activities. It doesn't necessarily have to be social. Sometimes just, chatting with people, through text is all the social connection or support we need in order to mediate our resilience. M, meaning. That's the sense of purpose that we get in the activities we do. And most of us got into this profession because we felt a calling to it. There's something about it that resonates with our values, is important to us. So the more that we can call back to our sense of meaning or purpose, in the work that we do and the roles that we have outside of work, the more it can help give us context for the stressors we're experiencing. And then finally, achievement. Achievement doesn't have to be grandiose, doesn't have to be as big as landing a big promotion or gaining a degree. It can be the little things, such as finishing a puzzle, getting a high score or a low score in golf or a high score in your video game. These little things make us feel good because we had to work towards them. We get the sense of achievement from a goal. So really anything that aligns with this PERMA model, positive emotion, engagement, relationships, meaning, or achievement can be a resilience coping activity. Next slide. I want to say a few things here just on what I mentioned about recognizing the thoughts that are going through your head. When we get really stressed out, we have a tendency, our mind has a tendency to get really pessimistic and to think in negative and overarching tones. But our thoughts don't really mean anything. They're just kind of there. Our complex computer algorithm of a brain does its best to sort through information and provide us guidance. And sometimes it's wrong. And it's important that we recognize that and can help our brain correct faulty thinking. So one example of this is overgeneralizing. So something bad happens to you and you may think in terms of, oh, things are never going to get better, or they're always going to be like this. Nobody cares about me. And when you find yourself using those all or nothing type terms, that could be a good clue that your brain's engaging in overgeneralizing. Next slide. Catastrophizing is an extension of this. So the idea that you take one singular event and try to extrapolate from that into these worst case scenarios. Oh, I screwed up, this facet of my job. I'm going to get, some administrative sanctions. They're probably going to fire me, and then I'll never be able to find work again. I'm not going to be able to pay my mortgage, so I'm going to get kicked out of my house. My family's going to leave me. I'll lose all my friends. Now I'm going to, end up living poor and destitute under a bridge. That would be an example of catastrophizing, but our mind makes it seem logical. That's why it's important to recognize when it's giving us those kinds of thoughts. Next slide. A few other examples. Holding on to prior beliefs that may no longer be relevant. So this is when we just make assumptions that things are going to work out a certain way, and we just completely implode when they don't work out that way. So if you find yourself saying must or should, that's a good example that you're getting yourself fixated on things and not able to adapt as readily as the situation might call for. Next slide. This last one is probably one of the biggest ones I see, is personalization. So that's where we give ourselves an inordinate amount of responsibility for things that happen, especially negative things that happen. Thinking back retrospectively and saying, oh, if only I'd done this, if only I could have done this, or I should have done this, putting the blame solely on ourselves, when really there's usually multiple facets and shared responsibility, even for negative outcomes, even when we did play a role in it. Next slide. So if you find yourself engaging in these patterns, one of the best ways that you can counteract them is by using what we call disputing questions. So challenge the evidence. Ask your brain, where is this coming from? What evidence do I have to support it? Or how do I know this for certain? One of my favorite questions is, how do I know, or what evidence do I have that the opposite is true? So instead of believing, say, for example, nobody cares about me, what evidence do I have that people do care for me? And sometimes all it takes is that one example to help us completely eliminate the negative thought and to disprove it altogether. Sometimes your thought processes may be right on. And so in those situations where you say, yeah, that does seem pretty accurate, you can ask yourself that bottom question. Say, okay, if it does happen, how am I going to handle it? And sometimes just having a plan for how we're going to respond to things in the future, even things that may have a low incidence or low probability of happening, can help assuage a lot of the fear and anxiety we experience about that situation in the first place. Next slide. All right. I'll let you guys read through this here, but I want to kind of keep moving because I don't want to take away too much of Jason's time. All right, next slide. So sleep is a huge problem, I think, for a lot of folks in healthcare in general, but especially for first responders, just because there's so many more challenges. And like I talked about earlier, the higher incidence of stress makes things considerably more challenging to come down from that high level of physiological arousal. I bolded here some of the more common recommendations I've been making to folks in these situations, the things that can be most helpful for them, right now. The biggest ones, like I show here in this slide, have to do with being consistent in your bedtime and wake time. Some folks have noticed they're staying up later as a way to try to decompress or sort through the day's series of events. It takes away from their sleep time, or they're intentionally sleeping late on their days off, or they're working 12, 24-hour shifts and are having a hard time kind of making this consistent. The more that you can find opportunities to be consistent on your days off, or get in a regular pattern for your bedtime, and especially your wake times, waking up around the same time each day. To the extent you can do that, you'll help to normalize your circadian rhythm and allow your body to start to anticipate when it needs to start winding down. If you're not able to do that as much, creating a pre-bedtime routine can help provide cues for your brain and your body that it's time to start winding down, and it's time to start to prepare for bed. And then once you do get in bed, don't get on your phone or tablet, don't watch TV, keep the bedroom and the bed just for sleep and intimacy. So, if you're getting in bed and going to sleep, do some relaxation exercises, some diaphragmatic breathing, progressive muscle relaxation, things of that nature to help bring your physiological arousal level down and help prepare your body for sleep. On that same by the same token, we also want to avoid things that are going to spin up our physiological arousal. So watch out for stimulants, especially 4 hours before bed. Try not to exercise or eat food or drink alcohol too close to bedtime, because those things will warm up your body as well. And then yeah, again, anything you can do to kind of help yourself relax, intentionally engaging in relaxing activities in the hours prior to bed are going to help you kind of bring yourself down and prepare your body for sleep. Next slide. If you notice you're having trouble specifically with sleep, I recommend the CBTI Coach. It's completely free for anybody to use. Has a lot of different modules and tips and strategies for helping you fall asleep and get better restful sleep. There's also these other two free smartphone apps can help guide you in some relaxation exercises, like I was mentioning, diaphragmatic breathing, muscle relaxation, things of that nature. If you've never tried mindfulness, I definitely recommend giving it a try. This is a great way to check in with your mind, check in with your body, and can really be not just relaxing, but help with insight into what's going on with you internally. Next slide. All right. As I mentioned before, we got to take care of ourselves physically as well. So if you find that you've been overeating or undereating, pay attention to that and try to match your eating habits to what you're currently using. So if you're not very active, your body doesn't need as many calories. If you're extremely active, make sure you're fueling your body the right way. And just remember, what you eat is going to affect how you physically feel. So if you're eating nothing but garbage, you're going to feel like garbage. If you're more conscientious about what you're eating, you're getting your fruits and vegetables, you're keeping lower on the carbs and fatty foods, you're going to feel more energetic, and you're probably going to sleep better too. Next slide. A lot of us use physical activity as an outlet for stress management. And one of the biggest recommendations I have for folks is, if you're primarily using exercise as a way to manage stress, focus more on cardio. And a big reason for that is the physiological mechanisms that happens with cardiovascular exercise. The oxygen deprivation actually helps break down the hormones that are causing stress in the first place. So maybe scale back from the anaerobic activity like weightlifting or high intensity interval training, focus on more cardio if you're using it specifically to manage stress. And make sure you're carving in time specifically for rest. So it's okay to have periods of inactivity. In fact, you guys have probably heard everybody needs 8 hours of sleep. That's not exactly true. In fact, everybody has different needs for sleep, but really we need 8 total hours of rest. So that's sleep combined with low levels of activity, where we're allowing our body to just kind of rest and rejuvenate itself. To try to get that 8 hours of combined rest and sleep each day. Next slide. All right. Now, let's say you're doing all these things, you've been trying them for a while and they're not helping. If you guys start to notice that you're having some intrusive thoughts or recurrent nightmares, you just can't get your body to calm down no matter what you do, or you've got racing thoughts, or maybe like I was talking about with emotional exhaustion, you just don't feel like you can access emotions. You're not feeling bad, but you can't really feel good either. You just feel kind of numb all the time. Or maybe you notice you're having difficulty functioning. That's a good sign that you may need more help than what you're able to do just for yourself. Next slide. There can be a lot of stigma with help seeking in general. I think from my perspective, this has gotten better, at least over the past decade, where we're starting to normalize the importance of looking at your mental health and taking care of yourself. Just know that everybody struggles at some point in time. I've struggled, and I'm a psychologist. I've had to go, get counseling and get help before. We're all human, and we all have our own breaking points. So it's okay to ask for help. And really, I think that it takes a lot of courage, and to be that person who says, no, I do need to get help. And I view it, at least from my standpoint, as a sign of strength, as somebody who's recognized I'm not doing as well as I could, and I want to get better. I want to get back to what I was doing before, get even better than I was before. Those are the folks who I think really have the chance to excel, in life and their careers. So, just like you go to a physical therapist when you're struggling, or get an exercise coach if you want to bulk up or lose weight, don't be afraid to seek out help from a mental health professional. to help you, perform better in some of those areas of your life. Next slide. But it doesn't have to necessarily be formal. Many of us have social networks, untapped resources too, of folks who can provide us with support as well. And just generally, I recommend that you identify 3 people that you can go to for support. The first is going to be a cheerleader. So somebody who is in your corner, who will support you no matter what, who's going to allow you to vent. They just want the best for you. That's going to be a close friend or a spouse or a family member. We all need that person in our corner. A mentor, somebody who's experienced, somebody who maybe has been there and can advise you on what's worked for them or point you to other resources that have been helpful for them. And then a battle buddy. So, another military term, somebody who's right there with you, who gets it, who understands, and maybe currently experiencing what you're going through, and give you some validation to know you're not alone. Next slide. And this is why a peer support program is so important. Those folks who are right in the fight with us are in the best position to understand and empathize with what we're going through. And in doing that, we can provide ourselves with much needed validation and emotional support. So, if you don't have a peer support program, I definitely will encourage you to start exploring opportunities to utilize this, to stand one up. We actually did this for Nebraska Medicine at the start of the COVID-19 pandemic, and started with strategic planning. We identified what we wanted to accomplish, the basics of how this would work. We wanted to make sure that it was easy to access, that it was going to be confidential, and that was going to be true peers, and that our volunteers who are providing this peer support were trained in order to do this, and they knew the coping strategies and resources that they could lend to their peers. You have a process for how you're going to source those volunteers and train them to market the program so that people will take advantage of it, and look for opportunities to join with other existing wellness organizations within your own community. So if you've already got chaplains or an employee assistance program or a wellness program or something like that, look for ways that you can get involved with them and present kind of a unified front. And then get feedback from the folks that you're going to be serving in this peer support program. Ask them what they would see as important. Would they utilize it? What would make them want to utilize it? Things of that nature. And the next slide. I just want to show you kind of an example of how we marketed our peer support program. We actually got really great leadership involvement to where, in our colleague forums and in our announcements that went out to the whole medical center, Nebraska Medicine and UNMC, they would talk about this, they talk it up, they constantly remind and encourage people to reach out to we called the PINs, the Peers in Need of Support program. And then we got these flyers posted everywhere and just had this QR code that people could scan and go fill out an anonymous survey, and then we'd be able to connect them with a peer to give them support. So we are working on a kind of like a guidance document that gives more information about how to stand one of these up in your organization. And Laura and I hope to have that available soon, so that it'll become another mechanism that you guys can use for your specific communities. Next slide.
Perfect. Thanks, Dr. Walker.
I think that's it. All right, thank you. Sorry,
Yeah.
Jason, I took so much of your time, but I appreciate your understanding.
Yeah, thanks, Dr. Walker. And we'll go ahead and turn it over to our next presenter here, Jason Workman.
Oh. Hello, everybody. Now, this next set of slides is really going to be...
Jason, apologies. Do you mind just flipping your video on here?
Yep.
There we go.
There we
Perfect.
go.
Thanks, Jason.
I'm trying to hide, but thank you very much. So I will be following up with kind of taking it where Dr. Walker left off and walking into, sorry, got a little bit of sinus stuff going on. We're going to walk into kind of a really, next level, if you will, topic about what happens when we don't take care of ourselves, we don't look at resiliency, when we're not paying attention to things that can make a pretty big difference in our day-to-day lives. And one of the things is the need to change the culture of the topic of mental health and suicide. And one of the things is by and large, we don't want to talk to other people about our own mental health issues or maybe the experience of suicide in our own lives with family or friends or colleagues. And it typically is a pretty difficult discussion to have with people. Now, this is not something you just go ahead and go walk around, the hospital, the station, the firehouse, start talking about these things. It will, but it will be things that you start to pay attention to with people around you, your colleagues, your friends, yourself, and really begin to be truthful about the topics of mental health and suicide. Next slide. If we look at suicide among medical personnel, doctors are currently ranked as number one and as having the highest suicide rate in all professions across the board. And unfortunately, law enforcement pulls up as number three. And so we can see that we have right now in our audience, we have two suicide rates that are at the top. And that tells us something. Tells us, one, that you're in this high stress job. Two, there's a lot that does damage to you mentally and emotionally and even physically. And when doing your jobs, it starts to take its toll to the point where mentally you're not in a healthy place. Dr. Walker talked about resiliency. A lot of times I like to talk about resiliency being something very simple to utilize to explain resiliency as a rubber band or a silicone band around your wrist to support some cause. If you think about the difference between the two, the ability to be elastic and stretchable and utilized, it varies, right? From size to what's made of it, rubber versus silicone. And one of the things that is really big is you stretch those things to a certain point, and that's the stress you put on it. But when you alleviate the stress, typically it'll return to somewhat of a normal shape. But the more stress you put on those things, the less and less it's going to return to its normal shape. It'll begin to take a different shape, a different norm, if you will. But it has had a permanent effect upon that. Same thing with your jobs as careers, as professionals. You are constantly having stress put on you, stretching you to a certain point. But the problem is when we do not take care of ourselves, that stretching hits a breaking point at some point. And that band, that rubber band, that whatever band will snap, and it's irreplaceable for one. But for two, it's not repairable in the same way that it was originally created. And so the same thing with us as human beings, when we don't take care of ourselves and pay attention to the need for self-care. And some of these suicide rates are indicators of that. Next slide, please. So nurses were found to be twice more likely than general public to complete suicide. A lot of times in terms of nurses, they find that to be because, one, there's a lower autonomy in their jobs. There's a lot going on, pulling them from different directions. They don't hold as much autonomy as maybe a doctor or other professions that can come and go as they please or make decisions based on their own experiences and education. Avoidance of mental health services, stigma, increase in recent stress, especially in the last 2 years. And I don't even have to explain everything. We just know as professions in this educational moment that there's been a lot of stress in the last 2 years. Prior mental health issues that you may have suffered in the past, and high job demand and stress overall. You're all in a high demand, stressful job. And so now we had on the last 2 years, and stress has definitely gone up. So aside from the very first line there, this can also be applied to everybody we just talked about thus far. Next slide, please. We look at law enforcement and firefighters. This is a suicide rate. Now, Dr. Walker and I were talking yesterday and kind of sharing some different experiences and thoughts and what have you. And we were kind of going over our slides and what have you. But one of the things is both he and I are in agreement with this. We're not numbers people. These are not absolute numbers. We can take a look at these numbers and see that suicide rate is going down. However, can we bet on that? No, not necessarily, because those numbers are fluid. There's no demand for like mandatory reporting. When somebody completes a suicide, it's mandatorily reported to an X agency. So in a high stress, in all that's been going on the last 2 years, we can see that maybe not as much reporting has been going on. We can take a look at incidences where somebody has died due to alcohol use or drug use or a vehicle accident. They could have committed suicide, but you don't know for certain. Not very sure that that's actually what occurred. And so there's a lot that has been unaccounted for. And there's a lot of other factors in there, but I'm not going to get into every one of them. It's just to help you understand that this is pretty significant. Just in 2022, we have had 17 law enforcement suicides. It is only February 2nd. If we were to stay at this rate, we will be back up into about the 2019 numbers. Fire EMS did not have any suicides until 13 days ago, or up to 13 days ago. And now in the last 13 days, they've suffered 5. And so we see this as being a huge problem. And one of the leading causes, one of the leading reasons for it is people do not take care of themselves. They're not looking at the stressors. They're not looking at their mental health well-being and saying, what do I need? Because all of you are very much a helping profession. So as I'm going to help others, and this is my job, when 911 is called, or when somebody calls you up to the floor, or into the ER, or wherever you're practicing your craft, you are to be the answer person, and you're supposed to help solve issues. Most oftentimes that translates to your home life, where kids are going to look to you as being the person to solve problems. The significant other will do the same thing. Your family in general, a lot of times look to you in times of crisis for the answer. And so what's happening is more and more you're giving, but a lot of times professionals forget to look inward and say, what do I need and how can I meet that need? When I'm struggling, who's coming for me? What do I have around me that's going to help? And as Dr. Walker had pointed out, peer support, getting support, friends, people that you can partner with, battle buddies, somebody wiser. All those things are tools for you to take care of yourself. Next slide, please. If we look at some other things as to what causes maybe the idea of suicide or deep depression, mental health issues, we can take a look at risk factors. And while we can say, well, this is by and large general to everybody, well, yes, but more so in your professions, we see some serious factors with recent losses, whether that be physical, financial, or personal. So physical could be, maybe it's something tangible that you lost, a house, car, somebody you loved. Financial could be, unfortunately, you go through a divorce and you financially lose some finances that you thought you would have for stability in your future. Maybe there's financial changes. You look at personal loss, loved ones that you were very close to, hopelessness. Right now, we can see that hopelessness across the board in our communities when we have a presence of so many challenges. The duration of that hopelessness, that sense of hopelessness, and the severity. And the severity varies, right? We may know some people who've gotten sick in the recent couple of years or have had struggles and they've made a bounce back. Well, we know others that have gotten sick and have died, and we've lost loved ones or friends. That speaks to that severity. How close does it impact you? Obviously, substance use in general, impulsivity, poor self-control. As that goes up, so does the risk factor. So being mindful of your own control. Family history of suicide, the closer it is to you, like more immediate to family, the higher the risk can play out that you may be thinking or contemplating suicide. history of abuse in your past, diagnosed or newly diagnosed or chronic health issues, and also several different factors, age, gender, race, all play factors into risk factors. Next slide. The more that you can increase the safety factors in your life and lower the risk factors, the safer you are mentally to care for yourself and also think in a way that's more optimistic than pessimistic. And so some of those safety factors, positive social support, like Dr. Walker was talking about, your own spirituality, not religion, but your own spirituality. How healthy are you in there? Sense of responsibility to family, having children, having a pregnancy and looking forward to the child coming into the world and raising a child. All those are hopeful and beautiful futuristic things that tend to give you safety factors. Your life satisfaction. The more satisfied you are in your life, in your personal life, career, in your spiritual life, in just your family life, the stronger your life satisfaction is. So if you're struggling in 3 areas and not one, probably need to reach out and get some help and raise up those safety factors, strengthen them up, or make some changes. Or if you're healthy in 3, it's a lot easier to deal with that one that you might be struggling with. Reality testing ability, positive coping skills. The more positive coping skills you have, the better and stronger you are to recover from stressful situations, get some healing and rebuild that resiliency to be stretched again and stressed out, stressed again. Positive problem solving skills that you're able to mentally, respond to things that might be problematic with positive skills, then the better and the stronger things are for you. And a positive therapeutic relationship is very, very vitally important in terms of the more positive relationships you can have, the better. But like with coworkers that are very negative, that kind of Debbie Downer, it's kind of like the Debbie Downer or the Donnie Downer, if you will. The ones that always kind of bring you down, you stay away from those and increase the positive, the healthier you are, and the more safe you are. Next slide. Now, I'm going to talk about this particular slide. Dr. Eric Gentry created this, and I just merely stole it from him because it really helps my clients. I didn't steal it, he gave it to me. And it really affords a really good example of understanding trauma. So you have a covenant, you got your job, you have this compassion to serve where you are, and you have this vision for what that looks like, to serving the public, saving lives, taking care of those that are hurting, those that are, struggling health-wise. And so you have this covenant and a clear vision. Next slide. Yet it comes along that painful experience or learning experiences. Maybe that's a trauma that you've worked, the calls you've been on, things that affected you, like deaths of a baby or death of, a particular person that has been relatively impactful to you. Next slide. What happens is that memory, that experience leaves triggers of memory that could be related to sight, hearing, feeling, taste, and smell. And when it triggers, next slide, it oftentimes will create a reactivity. And if you want to just click the next 4 slides, that'd be great. Then happens dreading the public, becoming withdrawn. You start becoming critical of administration and colleagues. You get real cynical in general. Next slide. If you see it, the past painful experiences really being triggered and driving the reactivity away from your vision of what you originally started to work with and do this work that you do. And now it's taking you off course, and you're not seeing why you started out the way you did and still love, treating and caring and tangibly making a difference in people's lives. You're now off track and doing reactivity. Next slide, please. Go ahead and next slide. You want to take the trigger and replace it with some self-regulation. Next slide. By doing that, we take away the power of the triggering experience. Next slide. And we get rid of the reactivity because of that self-regulation. Next slide. And what that does is it really, with intentionality, puts you back on track to see the vision of why you are a nurse, why you are a doctor, a police officer, firefighter, medic. You see why, it clears the way for you to be reminded, this is why I do what I do. This is why I get up, in the morning or in the night and do my shift. Next slide. So all that to say, and I hope you understand how important it is when you work on self-regulation, you work on your mental health, you work on your resiliency, because this is your self-care. It helps you do what you want to do as your career and live the lives you want to live as family, as individuals, as people with dreams and goals. But you got to work on that to be healthier for yourselves. But now wrapping some things up, one of the main things I want you to really keep in mind is just because a person appears fine doesn't mean they are. If you look at that apple in the picture, we see the backside of the apple a lot of times with people that are around us. Hey, how you doing, John? Fine. Hey, how you doing, Mary? Good. But we don't see the side where something is taking a big bite out of the backside and they're really struggling. They can hide it well, but really on the truthful side, they're struggling. And so when I say that, I want you to think about when you're working in your environment, be aware of those that are around you. Really be aware that, they may look fine, they may act fine, but be gentle with them because they may not be fine. And if they're not, if you sense something, check in with them. Kind of try to become that battle buddy, if you will, and come alongside them and go, hey, I'm with you. Are you doing okay? And the other side of that is just because you're fine now doesn't mean you're always going to be fine. I had a 60-plus-year-old gentleman come in and see me as a therapist, and he was really struggling. And he'd been a first responder for many, many years. He retired, did it part-time for a while, and then officially fully retired. He was driving down the road one day, and suddenly something happened that triggered a trauma memory for him, and it just caved his whole world. And he really began to struggle with the trauma that he had experienced over all those years and really needed to take care of himself. I've had that all the way to the police officer wasn't even out of FTO training involved in an officer-involved shooting. And so you have this whole span. You don't know when trauma or stress or life stress is really going to affect you mentally, emotionally, physically. And so you need to be aware of your ability to cope and your ability to be resilient and when it's time to reach out for help. Next slide. So that being said, Dr. Walker talked about peer support, talked about some different services you can utilize where you're at. And I really encourage you to do those things because the more you can do that there where you're at, the more support you get at work. But also, if you need professional counseling, the First Responders Foundation serves first responders. We serve veterans and active military as well as medical personnel. And so in here is our information. This is our website. We provide behavioral health counseling. We have counselors on site that specialize in different things and specialize with children of first responders, medical personnel, spouses, and the first responders and medical personnel themselves. We also have here on location an 8,000 square foot wellness center, a fitness center, and this for like CrossFit and jiu-jitsu, yoga, and we have also other workshops that are beneficial to you as well. My contact information is there, and you'll get it at the end as well. Now, we also have some other resources for you, support groups. We have a peer support group for first responders, spouse support group for those, because your spouses are in this ride with you. And there are times when it's very, very difficult to be that significant other at home and taking care of kids or the house or not connecting with you, and they need their support as well. We have a medical support group specifically for doctors or nurses. All these groups are confidential, and you just reach out to the foundation. We'll be able to give you the information, day and time and location, but we don't just put that out in social media or on the internet. We ask you call in to keep that confidentiality. And then there's a substance use support group as well for first responders. Next slide.
Perfect. Thanks, Jason. And James, thank you, Dr. Walker, for presenting today. If you guys, we have a couple of questions. If you guys don't mind answering live, I know we're right at time. The first question, Jason, I think is targeted towards you. Is the numbers for the suicide that you presented, are those nationally or are those in the state of Nebraska?
Those are nationally.
Perfect. Thank you. And then Dr. Walker, I don't know if you mind addressing, but what are some of the best ways to break down the negative stigma of mental health barriers to open communications? Or Jason, if you have anything.
I think there's a handful of strategies, but it really has to start with the individual. If there's a lot of stigma going on, then a community, an organization needs somebody to stand up and provide that first exemplar of somebody who's willing to, at the very least, broach that topic, to have that discussion and start asking people, hey, how are you doing? How are you feeling? Have you thought about, talking to our chaplain, or going to see that mental health professional or EAP? And from a longer term strategy, I think there needs to be engagement from the formal and informal leaders of the organization. So those people who not only say it's okay to feel like you're struggling, to reach out to mental health, but also actively support it, or even lead by example in that regard. I've had several situations, very positive situations, where in the military we had commanders who would come in and see us for mental health services, and then they would talk to all the 200, 500 people under them about the fact they were doing that, to help normalize it and let them know it was okay. But that involves a culture change, right? And that can take a lot of time. The best thing we can do as individuals is to start to have that conversation within our small circles with our coworkers, and even if it's just one-on-one, to check in with folks and ask how you're doing and normalize that kind of conversation happening.
I absolutely agree with you 100%.
Perfect. Thank you. And we have one more question that just came in. Do either of you see any differences between the rural versus urban areas?
Yeah, I would definitely say one of the things, when you have urban versus rural, one of the sad facts is that the numbers escape me, but over 90% our fire department in Nebraska is all volunteer. And if you think about it, that's also ambulance, right? And so EMS, most of that's volunteer as well out in the rural districts. And one of the problems is, like, when COVID hit, imagine the stress level at that point, especially on the initial onset of COVID, when I'm going to be called out to a medical call and I really don't want to get COVID, bring it home to my family, much like urban. But the problem is out there, it's a choice. I can just not answer the call. Here, when you're on, you're paid, you don't get that choice, you're going. And so there becomes this unfortunate sense of, departments letting down their communities, individuals feeling guilty for wanting to protect their family and themselves, weighing also the issues of convalescent homes or rest homes in the area. When they're high in a community and COVID struck, they were really experiencing a lot more death than they've done before. And so the more rural, the more problematic those kind of things become, of moral and ethical choices that raise a lot of stress level, and then they don't have the amount of behavioral health support that urban areas have, where they can just look up a therapist and go, or find culturally competent therapists that can work with medical personnel or first responders in dealing with some of these high stress job situations, high stress life situations, with that cultural understanding of first responder life. In the rural counties, they don't have that. And so that just really tends to be much more stressful on the family, and mentally much more of a struggle for them
Perfect. Thank you, Jason. That's all the questions that we have. So I appreciate both of our presenters today, and then we'll post the CE information, and we look forward to seeing you guys at our next webinar. Thank you.
Thanks, everybody.